All right, thank you for all that, Mike. Well, many women who've been told they have endometriosis or uterine fibroids might actually be suffering from a condition called adenomyosis. What is it and why is it so difficult to diagnose? We ask interventional radiologist Dr. Eric Hardee. Welcome to Houston's Morning Show. Thank you for being in here. Tell us what the similarities are, first of all, of endometriosis and uterine fibroids.
Good morning. Thanks for having me. Well, as far as adenomyosis and endometriosis are essentially the same disease process. Endometriosis is where the inner lining of the uterus, the endometrium, grows outside of the uterus, inside the abdomen or pelvis. It can cause abdominal pain, pelvic pain, painful menstrual cycles, painful intercourse, can cause infertility. Well, that same endometrial tissue can penetrate and grow within the muscular wall of the uterus. The wall of the uterus is essentially made out of smooth muscle cells, same type of cells that make up the heart, blood vessels, and other structures of the body. When you have the endometrium growing inside the muscular wall of the uterus, it can cause very painful, heavy menstrual cycles, painful intercourse, and the symptoms often overlap with the symptoms of uterine fibroids. Both disease processes are very, very common. Fibroids may be more common in African American women, and adenomyosis and endometriosis may be more common in Hispanic women, Caucasian women.
All right, now that we understand all of that, thanks for breaking it down for us. Can you explain what adenomyosis is and then why it's often misdiagnosed?
Well, adenomyosis is where those endometrial cells penetrate directly into the wall of the uterus. The endometrium is glandular tissue, and when that penetrates the wall of the uterus, it creates a lot of inflammation. And usually around the time of the menstrual cycle, women will have very heavy, painful menstrual cycles, along with other symptoms like painful intercourse.
All right, so how prevalent is that problem? Is this fairly rare? Because it's not a word I think that's common in most people's vocabulary.
Endometriosis is extremely common. It's estimated that anywhere between 10 to 15% of women of childbearing age will have endometriosis in some form. As far as fibroids go, fibroids is even more common. By the age of 50, 80% of African American women will have fibroids, and about 70% of Caucasian women will have fibroids. Only about half of women, or slightly less, with fibroids will have symptoms, though.
All right, for those women who do have symptoms, do you highly suggest that they get to their doctor, that they talk about it and figure out a way to detect exactly which one they might be suffering from?
Yes, usually history and clinical exam can diagnose many of these disease processes, but it usually comes down to some kind of imaging, either ultrasound, sometimes MRI for the definitive diagnosis. And endometriosis may only be diagnosed in some ladies once they have laparoscopic surgery.
And then what is your advice for women when it comes to advocating for uterine-sparing treatment?
Well, I think it's a general trend in medicine now to try to do the least invasive procedure or treatment initially. First, try that, and if that doesn't work out, then you can always go to more invasive options such as surgery.
All right. Thank you for your time this morning, Dr. Hardee. It's good information for women to know and better understand.
Thank you.